services that they provide. But let me say this, that every single cent is paid for by the government. And we are happy about the quality of some of the services. But we also have to manage demand, cost, because health is something, Vijay, where the demand, if it is not managed, if it is not done properly, can be completely out of hand, and it can become unaffordable to the ministry, to the government, and to the country as a whole.
Let's go to preventative care. One of the things is, a lot of issues in relation to NCDs. 80% of our deaths in this country comes from NCDs. We then have issues with HIV. Reported numbers, as we know, already more than 500 new cases. Majority of them unprotected sex. Of course, there's other factors including drugs, etc., which is contributing to that rise in cases. Mental health is another one. Domestic violence. We have one of the highest rates of domestic violence in the world. All of these needs a level of prevention or education that we are able to address this.
Well, Vijay, we as a government, and in particular the Ministry of Health, we had asked the World Bank to do a review of our health sector, and as I said, the report is out. It will be launched by the Honorable Prime Minister on Friday, and as I said, it will have some damning findings. For example, we are a middle-income country, but our health outcomes are that of a low-income country. That's all I can say.
It's very damning.
Very damning at this point. And I'm hoping that this report will trigger, actions, policies, and our ability to address some of these fundamental issues. And as I said, Vijay, this is not something that has happened in the last 2 years or last 6 months or last 1 year. This is a culmination. This is a legacy of failed health policies of the past, inability of the previous government to honestly address some of these fundamental problems. Public health, spending more in public health makes economic sense. The focus was shifted away from public health, away from NCDs, to thinking about building, as you said, hospitals and all that. And today, what has happened is all this public health neglect has led to a public health emergency. So as you said, more people are dying of NCDs. More people are dying of, kidney problems. These are issues that will have to be dealt with. So we will be obviously, putting out some announcements after the launch of this report as to how we plan to deal with it. But people have to understand, and I have to be very honest. We are now open, honest. We admit, we accept, findings from experts. We don't start criticizing them. We are not defensive because we know that there are serious problems. And these problems have been a result of those failed policies. And it's our job now to fix it. And we will fix it.
We all have to wait as a country. We are stuck.
Exactly.
It's the reality of the situation. Now, the thing is, other questions that have come in about our expecting mothers. These are the brave women. They go through a very trying time to give birth. And some of the questions that have been sent is that if the Deputy Prime Minister can go to the maternity hospital and assess what type of service the Ministry of Health is providing and talk to the nurses in relation to that. Because they say they are mothers, they are daughters, their sisters, and they go through trying times based on the facilities and services are there. Deputy PM, are you planning to take a tour of the CWM hospital based on that request?
Look, I absolutely understand, those kind of comments, those kind of frustrations. I'm not saying that it's the same everywhere. I've been to CWM hospital since coming into government, twice. I've visited all the hospitals, including Lambasa, Wanikoro, Ba, Lotoka, Tabua, Reki, Singatoka. I visited all the hospitals, and I wanted to see for myself as Minister of Finance, as somebody who was passionate, when I was in opposition, about improving our health outcomes, and so I appreciate those kind of honest comments, and there are areas that we can improve significantly, and sometimes it doesn't require a lot of money to fix some of those basic things. And I think the Minister for Health has been very honest about some of these issues, and we as a government, we want to fix it, and we will, Vijay. This is part of the strategy that we have put. For example, this health sector review, the pharmaceutical review, and our determination to fix this is there. We just we are working on it, and I can understand some of the frustration, some of those comments. But I also want to say that in the last 2 years we have made some definite improvements. There are areas, there are instances, cases where things have not worked well, particularly at CWM hospital. But if you go to other health centers, other subdivisional hospitals, I was in Tabua, and I talked to the subdivisional medical officer there. She's done a wonderful job. People who go there seem to be happy about the services. But as I said, nowhere should people feel that health facilities, health consumables are not up to standard. Because as I said, we have the money, we need to get down and do the work.
Again, you had the money, and this was in the case of overtime. You would be very aware of this case, where there was a circular from the Ministry of Civil Service, Ministry of Health, of course a shortage of staff, and then because there was a directive that you can only take time off in lieu and no overtime, they decided to close some of the services like the pharmacy and x-ray services, etc., after 4:30, and it created a major uproar because some of those services are critically needed. What are your thoughts on that, knowing that the money is there?
That should not have ever happened. The ministry is responsible, as they did eventually, should not have let that problem happen. So I'm glad that it's been resolved now.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.